Good morning, everybody. I have nothing to disclose. I'm going to be talking about the relationship of activated caspase-1 with improvement of metabolic profile after laparoscopic bariatric surgery. So to give you a brief overview of the relationship of obesity and inflammation, in obese individuals, there's a number of stress factors which are present, such as free fatty acids, reactive oxygen species, high glucose levels, which will cause activation of NOD-like receptor proteins, such as NLRs. These end up recruiting caspase-1 to form a structure known as the inflammasome. This inflammasome downstream will cause activation of pro-inflammatory cytokines such as interleukin-1 beta and interleukin-18, which will lead to chronic inflammatory state, especially in obese individuals. This dysregulated microenvironment, which is produced by the chronic inflammation, is going to lead to a negative impact on the mitochondrial function in metabolically active tissues such as skeletal muscle, adipose tissue, and the liver tissue. In our study, the hypothesis was that weight loss after bariatric surgery will cause reduction in inflammation at the cellular level and also improvement of mitochondrial function in the monocytes and skeletal muscle. This is an IRB-approved prospective study. Candidates who were recruited were between the age of 19 and 70. We utilized standard NIH criteria for determining the necessity of a bariatric procedure. These patients underwent either a laparoscopic sleeve gastrectomy or a Roux-en-Y gastric bypass. Blood was obtained at various time intervals and measured for a lipid profile, a CRP, a HOMA-IR score, and also for analysis in the lab. Similarly, we harvested skeletal muscle from the right thigh using a core biopsy needle at various time points again. The blood that was collected preoperatively and at other time intervals was used to collect peripheral monocytes. These were further analyzed to determine the levels of activated caspase-1 and also to determine the mitochondrial function by determining the level of mitochondrial respiration. Mitochondrial respiration was also measured in the skeletal muscle at 0 and 12 weeks. We were able to recruit 20 patients in our cohort. This study is still ongoing. We had to also discard some patient data in the initial period when we were standardizing this relatively novel protocol. The average patient age in our cohort was 41 years. The average percentage excess body weight loss in our patients in 12 weeks was 30.3%. The lipid profile in this relatively short follow-up period remained relatively unchanged. A majority of these patients were on lipid-lowering medications. The HOMA-IR in 7 of our patients in this cohort who were insulin resistant decreased from a value of 3.0 to 1.2. The CRP levels, which is a very generalized measure of inflammation, showed a modest decrease, but it was not significant at this time point. The caspase-1 levels, the activated caspase-1 levels, also show the trend to decrease at 12 weeks after surgery. Impressively, the monocyte mitochondrial function at 12 weeks was already starting to show a significant increase. The skeletal muscle mitochondrial function also showed an increase at 12 weeks after surgery. In conclusion, our data from this study suggests that increase in mitochondrial respiration is possibly in response to the decreased levels of activated caspase-1 and is probably the earliest biochemical parameter which is prognostic in nature to change after laparoscopic bariatric surgery. Of course, our study is small. It has various limitations. The power is very small at this time point. Also, the follow-up period for our cohort has been very short. It's only been 12 weeks post-surgery, where a lot of inflammation is still going on post-operatively. The further directions of this study would be to study similar parameters at a longer time intervals, such as 6 months and 12 months, where the weight loss is relatively plateaued. The other important thing to know would be to elucidate the role of novel molecules such as activated Caspase-1 and study them as a potential therapeutic target for treating metabolic derangements associated with morbid obesity. Thank you.